Hypertension or high blood pressure has a reputation as the silent killer because people have no symptoms, and yet allegedly it leads to all kinds of sickness and even death. According to the World Health Organization, 1 in 3 people in the 30 to 79-year-old age group have hypertension, so there's a good chance that they are including many of us. The only way to make the diagnosis is by regular checks, and the medical industry eagerly steps in to lower blood pressure with medications. However, are they looking at this whole thing in an upside-down way? And is hypertension even a specific disease? In this video, we investigate where doctors are getting their narratives from, who is really at risk in this system, and if you need to do anything about your blood pressure.
You can't see it. You can't feel it. Yet thousands of men and women are dying from high blood pressure. It strikes without warning in many ways, including stroke, heart attack, and kidney failure. Check your pressure. If you have high blood pressure, stay on your medication, because the silent killer may be stalking you. Don't think just because you feel good, the killer won't strike. High blood pressure, what you don't know about it can kill you.
Please note that in this presentation, I'm going to focus on what is called primary or essential hypertension. That is the most common form of alleged high blood pressure that you will be labelled with or will hear being discussed. There is a less common form known as secondary hypertension, in which the mainstream medical system identifies a specific cause of elevated blood pressure. Examples of this are certain types of cancer, severe kidney disease, and poisoning from substances such as arsenic and many pharmaceuticals. With regard to the common and apparently pervasive variety, the CDC's About High Blood Pressure page states that normal blood pressure is less than 120/80 millimeters of mercury. High blood pressure, also called hypertension, is blood pressure that is higher than normal. In other words, 120/80 is now considered to be high blood pressure. When I first started working as a doctor around 20 years ago, 120/80 was considered to be perfectly normal. Additionally, it was simply an approximate measuring point for what might be called average blood pressure. Nobody was too concerned if the figure was 120/84 or 126/80. The CDC even promote a traffic light system to suggest that 120/80 now warrants an orange light as, quote, elevated blood pressure. As we shall see, the target audience has been widened, and there's a good chance that now includes you. But first, let's see how the CDC believes it can make these claims. On that front, there is only one reference at the bottom of the page. There are more acronyms than you can poke a stick at here, but the main title is Guideline for the Prevention, Detection, Evaluation and Management of High Blood Pressure in Adults. This is a large review article that appeared in the journal Hypertension in 2025. This journal has a huge influence in the medical industry and has been published since 1979. According to the page metrics, this particular article has been downloaded over 1 million times, which is a veritable blockbuster. Hypertension is published on behalf of the American Heart Association, but ownership and control goes back to Wolters Kluwer, the Dutch multinational company that provides, quote, information services to various professions including medicine. Doctors in the system are often directed to Wolters Kluwer services, such as UpToDate, a platform that is marketed as, quote, trusted evidence-based solutions for modern healthcare. By 2017, it was reported that more than 1.3 million clinicians in 187 countries consult UpToDate's website and mobile apps, viewing more than 32 million topics per month. Most health practitioners that consult the platform will think it is an organic source of sound information, when it distributes, in fact, a carefully curated industry narrative. UpToDate articles are peer-reviewed, but they are done so anonymously, which is very suspicious. And it's not just me that finds this suspicious. In 2014, an article titled Conflict of Interest in Online Point-of-Care Clinical Support Websites appeared in the Journal of Medical Ethics. The authors scratched beneath the surface and were able to discover conflicts of interest in all 6 UpToDate articles that they reviewed. As they wrote, Reported conflicts of interest included research grants, consultancies, and speaker fees. And here in Table 1, they summarise the multiple conflicts of interest that resulted in the promotion of numerous brand-name drugs from many of the world's largest pharmaceutical companies. This cannot be glossed over. To repeat, there are millions of doctors around the world who go to the site for clinical guidance that is said to be evidence-based. I will confess that is one of the platforms that my husband Mark and I consulted when we were on call in large hospitals back in the dark days of our mainstream medicine careers. Doctors look up a topic or the diagnosis that a patient is said to have and may then prescribe medications as advised by these so-called evidence-based articles. If there was any doubt about how powerful the parent company of these publications is, last year the revenue of Wolters Kluwer was around 6.1 billion euros. While this does not automatically dismiss the Hypertension Journal into full-blown industry propaganda, it should make anyone skeptical of their publications. Equally concerning is that, as we have just seen, it is the one and only reference relied upon by the CDC with regard to blood pressure. Back to our guideline article in the Hypertension Journal, and an important factor to note is that this is a very lengthy document. The good news with regard to reviewing it is that most of it is complete fluff, so we can concentrate on the more crucial aspects. For example, Section 3 includes a subpart, Causes of Hypertension. Wait! Wikipedia reminds us that essential hypertension, also called primary hypertension, is a form of hypertension without an identifiable physiologic cause. Never mind. The authors quietly apply some scientific concealer with terms such as complex interplay and inter-individual differences to cover the cause issue. Table 8 then purports to list the factors in bold that are also said to be the causes of hypertension. Among the dietary factors, we can see that higher sodium intake is listed at the top of the table. But is this even accurate? According to the research of Daniel Reuters, this claim about dietary sodium is clearly unfounded. As he wrote in his 2024 book, Can You Catch a Cold?, there is a long-held belief that sodium is the cause of hypertension because when people eat table salt, their blood pressure increases. It may come as a surprise to learn, however, that scientific evidence does not support this belief. Sodium chloride, table salt, increases blood pressure in humans and animals, but this effect is curiously absent when people consume other sodium-containing compounds like sodium bicarbonate, sodium ascorbate, sodium phosphate, sodium citrate, or sodium amino acid chelate. It is obviously problematic when the authors of the Hypertension Review are not even getting their basic premises correct. It doesn't get any better when we see genetic variants at the top of the list of non-dietary factors. In the article, it goes on to state that blood pressure is a highly heritable trait, and hundreds of independent genetic loci capable of affecting BP have been described to date. Each variant has small effects on BP alone, but collectively they may explain larger inter-individual differences in BP. Nonetheless, all genetic loci described to date explain less than 10% of BP variants. In other words, this is complete nonsense to claim it is a cause of disease. Keep in mind that almost half of the world could be diagnosed with the mainstream definition of hypertension in their lifetimes. So these extensive genetic trawling attempts are not even remotely close to providing objective markers on this front. This is a particularly important point when we consider the 11 factors said to contribute to high blood pressure. All of them are related to lifestyle and environment, apart from genetics, which, as we have just seen, doesn't even add up on their own terms. We have also seen that the first claim about sodium intake is not supported by sound science. Some of the other purported dietary factors are equally dubious because lower potassium intake and lower calcium and magnesium intake are confounding variables. The next factor claims that a lower diet quality equates to lower intake of plant-based foods. Once again, confounding is involved, and just as concerningly, it echoes industry-derived propaganda. For more on this, please watch my video, Kellogg's, Germs and Food Pyramids. The non-dietary factors, obesity, lower physical activity, sleep disturbances, psychosocial stressors, and air pollution, all sound plausible. However, the stark reality is that all of these factors drastically affect general health. It makes little sense to collate such vast-ranging factors and then measure one variable in the form of blood pressure to conclude it is the latter that is a specific disease entity. I'm not saying that blood pressure is meaningless, but if it has been adversely affected in some way, then the focus should be directed upstream to the reversible factors that impact hugely on general health. Those who are not as familiar with the medical industry might be led to believe it is good that doctors are aware of some of these lifestyle factors that affect health. The reality is that consultations are short, while blood pressure is easy and fast to measure, and particularly easy to document. It is a practice that doctors are taught to focus on as soon as they start their clinical training. Add in guidelines that say a reading of 120/80 or above is abnormal, and millions of people will be given the hypertension label. Once someone is labelled with high blood pressure, in the medical system, it is typically just a matter of time before they are prescribed drugs. After listing the numerous types of antihypertensive medications, the Hypertension Review recommends that systolic blood pressure is kept below 130 and preferably below 120. In terms of preventing cardiovascular disease, the body of the text states that strong randomized controlled trial evidence supports 4 classes of first-line agents compared with placebo. While that might sound superficially impressive, there are several issues to consider. One is that neither drugs nor placebo are doing anything to address the more important upstream factors we've just discussed. The second issue is, what kind of numbers needed to treat are they talking about? In medicine, the numbers needed to treat means the numbers of patients that need to receive an intervention to prevent one adverse outcome, such as a heart attack or a stroke. Interestingly, we do not even need to look beyond mainstream sources to see a problem here. For example, in 2020, MD Links reported that in people receiving antihypertensive therapy for 5 years, the numbers needed to treat to prevent one death is 125. Additionally, the numbers needed to treat to prevent heart attack is 100, and to prevent stroke, 67. But what about people with mild hypertension, systolic blood pressure of 140 to 159, or diastolic blood pressure of 90 to 99, without pre-existing cardiovascular disease? Do blood pressure medicines prevent cardiovascular events in these patients? The answer is no. After up to 5 years of follow-up, people with mild hypertension taking blood pressure medicine experienced no differences in mortality, cardiovascular events, coronary artery disease, or stroke, according to the authors of a review on the NNT. Not incidentally, 1 in 12 patients experience side effects from the medication. So on their own terms, the vast majority of people that take blood pressure medications get none of the claimed major benefits from them. This is crucial because the promised benefits are how they are deceptively sold to patients. The doctor will say something like, "There is strong evidence that these medications reduce the risk of a heart attack or stroke." To the patient, that sounds like they will personally receive the reduced risk. Instead, the doctor should be saying, "Do you want to take this medication for the rest of your life and hope that you are the lucky one out of 100 who doesn't get a heart attack?" Or they should be saying, "According to the guidelines, you have a disease called hypertension. Would you like to start a daily medication that has not been shown to have any benefit for your current blood pressure level?" It gets even worse than this because all of the antihypertensive drugs have a range of adverse effects. These include dehydration, electrolyte imbalances, higher blood sugar levels, attacks of gout, fatigue, depression, gastrointestinal disturbances, and kidney dysfunction. So not only are the majority of people on these drugs getting no personal benefit from them, but they are running the risk of damaging their bodies. This brings us to another important consideration, which is what most drugs actually do in the body. The mainstream sources have well-developed stories such as it blocks this particular receptor or blocks this particular channel to lower the blood pressure. The reality is that these narratives have been constructed by the pharmaceutical marketing industry to make it look like they are highly scientific and targeted inventions. I used to work in clinical trials, so witnessed how it actually operates. First, a substance is tested on small animals like mice, and then larger animals like monkeys. The effects of the substance on heart rate, respiratory rate, bowel function, blood pressure, and other metrics are observed. If it does something like lower blood pressure, then it may proceed to human trials for development as a potential antihypertensive. If Big Pharma take the product to market, then the doctors who deal the drugs will be given some catchy terms like highly selective or targeted therapy. The body does not see it this way. When a synthetic petrochemical derivative, aka a drug, gets into the tissues, it is an unwelcome intruder, that is, a poison. The body then activates its various eliminatory mechanisms, which may involve detoxification of the substance in the liver, and then ejection of the drug plus its metabolites through the gastrointestinal tract, bladder, lungs, skin, and vagina. So if blood pressure is lowered in this process, it is not some carefully engineered therapy, but rather one of the body's responses to eliminating a poison. It is clear that true health cannot be achieved by taking these drugs. They are prescribed by doctors who have been indoctrinated by narratives and guidelines that are in place for the benefit of the medico-pharmaceutical industry, not patients. It is a system that first invents criteria that make it appear like a huge proportion of the population have a specific disease, and then tells them that they need a remedy in the form of long-term drugs. Even on their own terms, most people taking the drugs admittedly receive no benefit. Worse still, all of them are at risk of the disclosed adverse effects, as well as the lesser-known problem of what these substances are to the body. Outside of the small number of acute medical situations involving hypertensive crises, the focus on blood pressure is very misguided. The concept has been elevated to a false paradigm of screening, monitoring, and pharmaceutical interventions under the guise of population-wide statistical significance. The propagandized doctors and the patients sourcing advice from them are the victims in the scam, with both parties thinking that the invented diagnosis is an important one to make. This then leads to the practice of, quote, treating the blood pressure as though it is a specific disease in order to bring about better health. To be frank, the vast majority of people are going to be better off if their blood pressure is not even checked in the first place. Otherwise, they risk being pulled into the medico-pharma industry's marketing funnel and its false model of disease. If you seek true health, then your focus should be on everyday lifestyle choices, such as organic food, pure water, maintaining a healthy body weight, exercising adequately, and mitigating exposure to chemical contaminants and pollution. And as always, it is about maintaining a spiritual connection and finding purpose in life so that psychological stress does not end up literally killing you when the body tries to find a way out. In short, put your energy into life and well-being measures rather than chart numbers and drugs. For tips regarding this aspect of health and much more, please check out all of the free resources at drsambailey.com. If you enjoyed this video, please visit supportdrsam.com.